Good morning, everyone. Thank you so much for joining us. We're just going to give everyone a moment or two to log on and we'll begin shortly. Okay. All right. Good morning, everyone. Thank you all so much for joining us today. We are so pleased to present the Weill Cornell Medicine and New York Presbyterian Kidney and Pancreas Transplant Program, Conversations with Cornell Kidney. This is a 6-part virtual education series for patients, caregivers, and our transplant community. For Conversation 4, we will discuss post-transplant care. Our speakers today are Judith A. Hambleton, Chief Transplant Coordinator and Nurse, and Eliza Bensley, Clinical Transplant Educator and Nurse. We encourage you to submit your questions in the Q&A section. We will try to get to as many of them as possible. At the end of this presentation, we will have one of our post-transplant PAs join to help answer questions. Please note that today's session may be closer to 90 minutes. If you cannot stay for the entirety of the session, a recording will be sent out. It is my pleasure to turn things over to Judith and Eliza.
Thank you, Alyssa. Good morning, everyone. So let's just introduce the program. First of all, it's one of the highest volume kidney transplant centers in New York. We're one of the highest living donor kidney transplant volumes in New York. We are Medicare approved, and we're also ranked one of the top nationally kidney paired donation programs. Our mission here at Cornell has always been to maximize the opportunities for our transplant recipients. We do that by increasing access, improving outcomes, and safely transplanting our patients. Next slide. So when do I expect to get a kidney transplant? What can I expect when I get a kidney transplant? Well, first of all, let's start right at the beginning and in the operating room. The surgery takes about 2 to 4 hours, and that depends on multiple factors. Kidney transplant is a procedure performed to give a patient whose kidneys have failed a healthy kidney from another person. The kidney may come from a deceased donor, that someone died and their family donated their organs, or it could come from a living donor. Next slide. So a person receiving a transplant usually just gets one kidney, and that's certainly the case if it's a living donor. You're only going to take one kidney obviously from a living donor. But in rare circumstances, we may actually use 2 kidneys from a deceased donor. Your native kidneys or your deceased kidneys, they're going to stay in place. They're only removed on a rare occasion in situations like if you have polycystic kidney disease and you have a living donor and the kidneys are creating, there's a lot of space taken up in your abdomen and into your chest. If that's the case, then one of your kidneys could possibly be removed. Transplant is placed in the lower abdomen, so your incision, you can expect it to be either the left side or the right side, and it's usually about 2.5 to 3 inches long. A kidney is the size of a fist, so you've got to imagine we've got to be able to fit that kidney in. We don't want to squish it or damage it, actually placing it in. The transplant's performed under general anesthesia, and you'll spend several hours in recovery room after the surgery. The reason for that is we want to keep a very close eye on you and monitor your vital signs, monitor your urine output, hopefully, and also make sure that you're comfortable. So, if you need some narcotic to take away the pain, then that's all taken care of in recovery room. So usually at about 10 to 12 hours, you'll be transferred from recovery into the actual transplant floor. And your stay on the floor is normally 4 to 6 days. Our average stay is 5, but on occasion, people can go home a little early or a little later. Next slide. So yes, congratulations, you got yourself a new kidney. Next slide. So the post-transplant visit schedule. This is a busy slide here. But once you're discharged from the hospital, we need to keep a very close eye on you, especially in the immediate post-transplant period. So that's usually the first 3 months to 12 weeks. You should expect to come back to clinic 2 or 3 times a week, and then weekly for the next couple of months. Now, since COVID, we really have become more adept at doing video visits and feel more comfortable doing that. So in certain circumstances, and if you're doing well, we can actually have a video visit rather than in-person visit. But that all depends on how you're doing, if your labs are stable, and you're doing really well. At a certain point, we also share your care with the nephrologist that sent you to our transplant center. If you don't have one and it was a PCP that sent you, we'll need to know about that, so let us know. But we will work closely with them and really help manage your care. It's a shared responsibility, sort of after that first 3 months. You will continue to come here. You're a lifer, so to speak. And, even if your visits are just once to twice a year, we want to know how you're doing so that we can make any fine-tune adjustments that we need to. There are certain tests that we're able to do at the transplant center that your local physician is not able to do. And so that's the reason that we will, on an ongoing basis, have you come on in. The more frequent visits to the transplant center may be needed if there is a bump in the road. This can happen. It doesn't mean anything's terribly wrong, but if we catch something early, then we can fix it. So, again, depending on how you do, really dictates how frequently you need to come in. Next slide. So our new center, we actually moved over here during COVID, but for those of you that have not been back since then, we're now located in the David H. Clark building, and that's at 1283 York Avenue. The hours are 7 to 4. If you need to schedule or change an appointment, the telephone number is for the post-transplant clinic, and that number is 212-746-3020. If the clinic is closed, it's still the same number, just to prevent confusion, and the call will be transferred to the nephrologist that's on call. As you can see, it's a beautiful building, state of the art. It was almost that it was built with COVID in mind. It's very tall ceilings and very spacious areas. It's a beautiful environment to work. If you're having a medical emergency, you need to call 911. Any other sort of routine matters, you can call us at the post-transplant number. But if this is something that needs immediate attention, then you go to your local emergency room or call 911. One thing to note, the clinic visits now are by appointment only. No walk-ins are allowed. Security is a lot tighter. And so you actually register when you're downstairs in the lobby, and you'll get your name band, and then you come through security and come up to us on the 9th floor. But they are beautiful, beautiful clinic space. Next slide. So preparing for your visit. We do like early starts, and certainly your first visit back is definitely going to be scheduled for 7 a.m. And the reason for that is that we want your lab tests back. you may have been discharged 2 or potentially 3 days before. And so we want to, again, just make sure that everything looks good, and, you know, we'll have the results back before we let you leave so that we can make any minor adjustments. Again, you know, even if something's a little bit off, it doesn't mean it's a problem. As long as it's identified early, then we can get it sorted out. Bring water and breakfast or snacks with you. Again, you are going to be here, you know, a few hours. Unless specifically stated, you do not need to fast for the blood work. You would be informed if that's something that you need to do. Now, the morning of these appointments, we want you to hold the Prograf and microphenolate, otherwise known as tacrolimus or Celsat. And the reason for that is that we're actually going to measure what we call the trough levels of this drug, so that we use that to adjust the medication doses as needed. Okay, so you would not take it until you've had your blood work. You get that done pretty much on arrival, and then you're able to take your pills and have your food that you've brought with you. Any inaccurate reading, unfortunately, may require a blood test, and we can see the difference. If you've taken it that morning, then that's not going to be helpful, and unfortunately, you would need to come back. Again, on your first visit, it's important that you would bring all your medications with you. So we're talking anything that's in the pill box, plus the bottles that you've gone home with. This is so that we can go over these yet again with you. It's a lot of information, and, you know, being told once or twice while you're in the hospital is probably not going to suffice to really get the message home of what each drug is, why you're taking it, the side effects that you could look for, those types of things. So we're going to go over and over that until you've really got this stuff down. And you're also going to be asked to complete your health record diary. This is something that we'll send you home with, and you're going to be recording all kinds of things that we're going to review in the next few slides. Next slide. So your immune system is a vital part of your body. We'd be in big trouble without it, but unfortunately in transplant, it can also be a little bit of an obstacle. So your immune system, what it does, it protects your body from outside invaders, things like bacteria and infections and viruses. The immune system also views a transplanted organ as a foreign invader. That's why that you need to take these medicines, and that suppress your immune system and protects the actual transplant from rejection. So the immune system is very complicated, and it's why you must take several different medications. It works in different fashions, and the medicines are able to block the different pathways, again, which is why there's more than one. So each medicine works in a different way, and the medicines each play an important role in protecting that kidney from rejection. Next slide. So rejection sometimes occurs even when you are the model patient and you're taking your medicine exactly as directed. There is an adjustment period, as I say, specifically in that first 3 months. You know, your metabolism changes when you become more active. There's all kinds of changes going on in your body. And we just want to make sure that before we sort of release you back to your own doctors, that we've got things settled down. So most rejection episodes can be reversed, and that's done by just giving additional medicines, either at a higher dose and your current medicines for a brief period of time. Having an episode of rejection does not mean that you will lose your transplant, but in some cases, if this is really severe, it can lead to the loss of the kidney. Rejection does cause damage, so it's not to be taken lightly, and it can reduce the long-term survival of the transplanted organ. So it's very, very, very important that you do take all of your medications just exactly as directed, and that's to protect the kidney. You want to keep this as long as you possibly can. Next slide. So protecting yourself from infection, we've got you on these immunosuppressant medications, and now what are we going to do to help you, be able to fight infection? Well, you may be at higher risk, certainly in the earlier period. So we're more concerned about the first 12 weeks than we would be the second, third, or fourth 12 weeks, because some of the medicine we give you is given IV in the hospital, and the effects do wear off over time. So the first thing you can do to protect yourself, and this isn't just transplant patients, this is everybody, is good hand hygiene. Wash your hands often with soap and water, or an alcohol-based cleaner such as Purell. Take your medications. For the first several months, you're going to be on medications to protect you from the most common infections seen in transplant recipients. So Bactrim is often the antibiotic that you'd be taking, and then one of the antivirals. 3, avoid people that are sick. Certainly, if somebody calls you and says they want to come and visit and they're coughing and sneezing on the phone, just tell them, I just got my transplant. I appreciate all that, but wait until you're well. I don't want to get sick. We're actually going to talk about mixing in crowds later on this morning, so I'll leave my comments for then. Okay, next slide. Get the flu vaccine every year, but you do need to avoid live vaccines. So, getting the flu vaccine was important before you were immunocompromised. Now it's more so. You should get this flu shot every year, and not necessarily immediately after the transplant, but give it 6 months to be able to protect yourself from the flu. You should also receive the pneumococcal vaccine, and that's usually given every few years. Any other vaccines, check with your transplant team, as again, some of them can contain live virus and could make you quite sick if you were to take them. Flu mist is one of those, and shingles is another. They're both live vaccines, and they should really be avoided. You also should avoid changing the diapers of babies who've received vaccines. So specifically, we're thinking about the measles vaccine there. After 2 weeks, then you're okay to help take care of the child again. Pets. This is a common question. What should happen to your pets? Certain animals, you're at higher risk. Parakeets or bats. I don't personally know many people that have bats, but maybe it's New York. They're probably out there. They carry a risk of infection and should really be avoided. You should also avoid handling cat litter if you possibly can. Obviously, some people, you've got to do it. So just use gloves. And, I'd also recommend a mask if it's the cat litter is sort of the dusty kind, again, just to be safe. Next slide. Oh, questions.
Thank you so much, Judith. We actually do have a few questions here. One of them is asking, what if your non-dialysis arm is not easy access for labs?
You would be one of the majority. In all honesty, people have very, very often had several fistulas placed, and they're tough sticks. We get it. We have a couple of phlebotomists that work for us that I cannot remember the last time they were not able to get blood. If you've been to the pre-transplant area, you'll have met them, but it's a rare problem. So don't let us worry about that. Don't worry about it.
Okay, and then someone else is asking, is it possible for rejection to occur months after transplant? If so, what happens to the kidney and to the transplanted kidney and patient?
So rejection is a term that is a huge range of medical things that can happen with rejection. Certain rejections, you're not even going to be aware of it. We may see a slight increase in the creatinine level and your drug levels are low and you don't even know about it. Your urine output stays the same. And that range goes all the way through to loss of the kidney. For loss of the kidney, you're not going to lose the kidney by just missing one dose of your medication. But I don't want you to feel secure in thinking, oh, it's not a big deal then, because it is, because each medicine, each time you forget to take a medication, that's just another tiny little bit of the kidney that's injured. So again, for longevity, it's key to be able to take your medicine exactly as prescribed and at the same times, if possible, each day. Does that answer the question?
I think so.
Okay, good.
And then someone else is saying, are there any dietary restrictions or rules post-surgery?
Aha, you skipped ahead. In our next section, we actually cover nutrition. So I'll leave that question to Eliza.
Perfect.
Thanks, guys.
We have one more here that says, how long after surgery does one need to be quarantined?
Oh, quarantine. That's a very strong term. You know, if the people that you're mixing with, and they're healthy and they've no sort of signs or symptoms, you're fine. They can come and visit with you. But what I say is use common sense. Why are you going to have a whole load of people coming over when you can wait just a few weeks? So again, it's not that you cannot see people. You can. You don't have to feel that you're on quarantine, but it's better if it's controlled. You know the people. You can trust that those people coming to visit with you are not sick. So that's, but if you have to go out and go to the shop, something else we're actually going to cover a little later on in later slides. So.
Okay, perfect. I think we've answered all the questions for right now.
Awesome. Okay. Well, thanks, Judith, for that really informative overview. I'm just going to cover something that you may know about, but you may be wondering, what is a stent? So some patients receiving a kidney transplant have a ureteral stent, which is a tube placed during your transplant surgery to help urine move from your new kidney to your bladder and keep the ureter open while you are healing from the surgery. The stent is removed by a urologist at about 6 weeks after transplant, and we will assist you in scheduling this appointment. However, it is also important for you to know that if you have a stent and to keep the appointment to have it removed, since the stent should not be kept in for longer periods of time because it can lead to infection. So this is just an image of what a stent is. As you can see, it's in the bladder and it's going up to that new kidney. Let's talk about monitoring yourself at home. So a rule of thumb is you know your body best, and you need to take a lead role in letting your transplant know if something doesn't feel right. So let's go over a couple examples that you should definitely be monitoring after your transplant. Your urine output. At home, you should monitor the amount of urine you make daily so that you will be able to tell if your urine output changes suddenly. For example, if you normally make about 1 liter of urine and all of a sudden you're barely making any urine, you should absolutely call the clinic. That could be a sign of major dehydration. If you normally make 3 liters and suddenly only make 1 liter, you should also call the clinic because any sudden changes we would like to know about. Pay attention to the appearance of your urine. If it is normal, clear, and yellow, that's good. But if it suddenly turns dark brown or cloudy or has a very foul smell, that can sometimes be a sign of infection. Weight. Now, many patients retain fluid after their transplant surgery, causing temporary weight gain. Patients can become dehydrated due to poor fluid intake, and this can cause weight loss. Patients who are used to limiting fluid from being on dialysis sometimes find it hard to keep up with the new fluid requirements after a transplant because for the longest time, you had to really limit how much you were drinking. And now we want you to hydrate that kidney. Patients should weigh themselves every morning when they first wake up and record a weight for the team to review. It is important to follow the instructions given by your team regarding your appropriate fluid intake. You may even be instructed to take a water pill. And the most common one that we would probably give you is called Lasix or furosemide or butamide, which is Bumex. And if you gain more than a certain amount of weight in a defined period of time, that's something to pay attention to. Rule of thumb, if you gain or lose more than 3 pounds in a day, you should notify your team, because that could really be a sign that something's going on with your fluid status. Blood pressure. It is very important to monitor your blood pressure after transplant, since both high and low blood pressures can negatively impact the transplanted organ, and it may require some changes to your blood pressure medication. High blood pressure can be a sign that some of the transplant medications can cause, and it could also be that your fluid is very high because you retained a lot after the surgery. And in the first few months after your transplant, you should check and record your blood pressure about twice a day and bring those results to clinic so we can make sure that it's looking good and that there are no adjustments needed. During this time, you'll get an idea of what your new normal blood pressure is after transplant. And just as a FYI, some symptoms of high blood pressure is headache, while low blood pressure can be dizziness or lightheadedness. And so just report all these symptoms to your transplant team. And just to pay attention specifically to that top number, if your top number, the systolic, is greater than 180 or less than 100, that's something that you should tell your transplant team. You know, the average, the goal blood pressure is 120/80. That might not be what you have, but you're going to have your new norm. But keep in mind those parameters. Temperature. You should take your temperature once per day, and usually in the morning, and more frequently if you're feeling ill. An increase in your normal temp can be a sign of an infection, but also when you're immunosuppressed, you may not mount a high fever. And so pay close attention to those other symptoms. If you're having chills, malaise, cough, nausea, vomiting, pain, urgency, or frequency with urination, that could be a sign of a UTI or a urinary tract infection. And maybe you aren't having a high fever, but there's still something brewing. We need to know. So make sure you're monitoring that. And if your temp is higher than 100 degrees Fahrenheit, you should call the transplant clinic. Your blood sugar or blood glucose. If you have diabetes, you may need to monitor your blood sugar more frequently after your transplant. This is true even if you didn't monitor your sugars before. Sometimes the transplant medications can raise your blood sugar, and we don't want that blood sugar too high and out of control because it can lead to poor wound healing and other complications. So it is really important to keep it well controlled. You may need to begin new medication by mouth, or in some cases, you may require some insulin in order to control the sugars. Again, these numbers to pay attention to: if your blood sugar is less than 70 or greater than 400, that's when you should contact your transplant clinic. We don't want you to have a hypoglycemic episode. And so those are really important things to monitor. And if you're listening to this and you're concerned that you have to memorize everything, I just want you to know that you're going to be given this education multiple times and you will have a lot of guidance. So don't feel like you have to write everything down and memorize this, but we just want to give you some of the introductory information. So let's go over your lab results. We're going to talk about a couple that we commonly check after transplant and explain why they're important. And just a reminder, you can always access your lab results on your MyChart app. This logo in the presentation is the MyChart. You're going to be able to go to your app store, whether you have an iPhone or an Android, and type in MyChart and download that and set up that account if you don't already have it set up. The MyChart app is just wonderful because you can message your provider, you can check your labs, you can keep your appointments in order. And I think it's one of the best things that we've done is become, using the MyChart app. And just keep in mind, your doctor will be able to explain these results, but if you do have any questions, you can always contact the transplant team. So let's talk about the creatinine. It's a word we've all heard, especially in the kidney disease world. And what is creatinine? It's a waste product made by the body and it's removed by the kidneys. And so when your kidneys aren't functioning adequately, the creatinine levels rise. And so we measure that creatinine to check how well your transplant is functioning. Ideally, once your transplant is up and working, your creatinine levels will drop and, normalize. So that's really an important indicator for us on how that kidney's working. Electrolytes. So many may think, oh, I know electrolytes, they're in Gatorade. Well, yes, but we are watching your magnesium, your phosphorus, your calcium to make sure that transplant is functioning and that kidney is making those levels normal. Sometimes your kidney transplant can cause these levels to fall lower and you may need to take supplements. These also can be impacted by diet, which we will talk in a little bit about. Glucose, as mentioned before, blood sugar. After transplant, some patients, both with and without diabetes, will have an increase in their blood sugars due to some of the medications. And so we do want to monitor that. Hemoglobin. Hemoglobin is the cell that carries oxygen throughout your body to the parts that need it. It's very important. And when your hemoglobin is low, you're considered anemic and you may feel tired and have lower amounts of energy. So it is important to make sure that patients' hemoglobin does not fall too low and that they aren't anemic. Platelets. Platelets are the sticky cells that help your blood to clot. Some medications may lower your platelet count, and a low platelet count may cause you to bruise more easily or bleed for longer periods of time. So it's important for us to monitor that. And potassium. Potassium's an electrolyte that we all, have probably heard of. We know that bananas are high in potassium, but it's extremely important to make sure it is normalized because too high or too low can be dangerous. People with chronic kidney disease and those on dialysis may be used to having a high potassium level, but after your transplant, a well-functioning kidney can cause those potassium levels to go low. So we're going to watch that and, if we need to give you a supplement. Tacrolimus or Prograf. It is one of the medicines most transplant patients take to help protect their transplant from rejection. In clinic, they will measure the amount of tacro in your blood and make sure you have a good level. And that's how they will measure that level to see what dose you need to be on. So it is really important that when you're coming to clinic, you don't take your tacro dose for the day before you get your blood drawn, but bring that to clinic with you. And so that's how they can get an accurate measurement. But once your blood has been drawn, you will then take your medication just so you stay on your schedule. And lastly, white blood cells, also extremely important. They help with our immune defense and they help us fight infection. And when we have a high white blood cell count, that could mean our body is fighting off an infection, while a lower count means that our immune defense is low. So we're at higher risk for infection. So we always want to watch those levels. All right. Post-transplant nutrition. I just want to let everyone know on this webinar that we're going to have a dedicated post-transplant nutrition webinar, not next month, but the following, and we'll go more in detail. So this is just the smallest overview, but it is very important to maintain a well-balanced diet. And that's because healing and recovery are contingent on those things. Your transplant dietitian will provide you with a nutrition plan before you leave the hospital. And this can be adjusted in clinic as you recover. Some patients who have delayed graft function or DGF, which means the kidney is a little sleepy and requires a little dialysis to wake up, they may have some of the dietary restrictions that they had prior to the transplant, such as limiting potassium-rich foods. But hopefully once the kidney is functioning, you can resume your post-transplant diet, which is a very balanced, healthy diet. And it is important that most patients can benefit from a low salt diet. I think most people can in general. But in other cases, when the kidney works so well, we talked about this, you can lose your electrolytes in your urine. And so sometimes we require some supplements or your diet. So again, stay tuned for the webinar on strictly nutrition, because we'll talk about, the potassium rich foods, the phosphorus rich foods, and how to navigate that when we have our dietitian join us. All right, so last bit of this section is post-transplant fluid intake. So we can't stress enough how important it is to make sure you're following the guidelines that your team gives you about your intake. You need to make, good amounts of urine. And if the kidney is functioning well, you'll need to drink as much fluid as you put out. Because if you do not keep up with that, your kidney could become dehydrated. And so, for example, if you're not on a fluid restriction and you drink 1.5 to 2 liters of fluid daily, that's likely what you would put out in urine. We know it can be hard for patients who are just on dialysis to adjust, but just remember, it's very important to keep that kidney happy. And for patients whose kidney is taking a while to wake up, you may again have that fluid restriction until it functions. But that is why at the very beginning, when we said, once you go home, monitor that urine output, just to make sure that you're not going overboard or you're not going too low with that fluid. And we want to just make sure everything stays balanced and healthy. So, questions?
So let me just take a look here. Someone is asking for a little more information about the shingles vaccine. Should you have it way in advance of the transplant in preparation?
I personally think that that's the smartest thing to do. Again, we want you to avoid it afterwards. Depending on your age, that's something that certainly explore. And I would also discuss it if you're on dialysis, or actually if you're not, just something to discuss with your nephrologist that you're working with now. So.
Fluid intake is largely just water. That's the question. Fluid can be beyond just water. So, any liquid that you are taking in, that would be considered your fluid intake. So whether you have a soda or a, glass of milk, that's still fluid. I hope that answers that question.
There is also a question about work. We're going to cover that in the next section, the third and final section. What else we got? Yeah.
And we have Johanna, who has joined our presentation, and Johanna is welcome. Johanna, do you mind giving a little background on you? And so our attendees can get to know you really quickly, because we're really happy you're here. She's one of our transplant physician assistants. And
hi, I'm Johanna Marko Podvorka. I've been PA for 16 years. I started with emergency room, then I did general nephrology. And for the past 11 years, I've been with the transplant, primarily working with post-transplant patients at Cornell.
Thank you so much for joining us. So yes, Johanna is the expert in post-transplant care. So we're really happy she was able to join us, and we will continue on with the presentation, and then we'll have some of these specific questions answered in just a few minutes after Judith gets through resuming life after transplant. So
now you've got your kidney. That's what we've all been waiting for. can return to normal activity as soon as you feel well. Your body is what's going to tell you, how to respond. Again, be active, do what you want. If you're falling into bed at night exhausted, you probably did too much, but we don't want you to be a couch potato either. So a lot of common sense. And, if there are specific questions, certainly that's what the post-transplant team are there for. Now, again, in the immediate post-op period, we do recommend taking a shower, not a bath. A bath is basically sitting there in all the dead blood cells, etc. So, a shower is fresh water, and that'll keep your incision nice and clean. You can wash with soap and water, but don't scrub it at all. You are going to have little steri-strips. It's just white strips of almost paper. And they're going to come off when they're ready to come off. Don't take them off yourself, okay? And exercise, again, it's important. It's part of being healthy, and it's part of feeling better. So after your surgery, start out slow. Maybe just a nice wander, 15 minutes, 20 minutes, but just gradually increase it. So each and every day you do a little bit more and a little bit more. It is important to remember, do not lift anything greater than 10 pounds for the first 6 weeks. The reason for this is that you will have a hernia. There is an incision, and the surgeon will be making double the money because he'll be taking you back to surgery to repair your hernia. So remember, lifting, that's important. Anything heavier than that, you will meet with your surgeon again. So that's a good time to ask them when they feel that it's okay to take on something heavier. And next slide. Crowds. So try and avoid crowded areas, enclosed spaces, at least for the first 3 months after surgery. Does this mean, if there is a big family event, again, just sort of take the temperature, find out, is there anyone there? How many people are going? Is there anyone that's sick? We don't want to isolate you, or quarantine, I think was the term that was used a little earlier. We don't want to do that. Again, this is so that you can get your life back. But just be cognizant of who it is that you're mixing with, and are they people you know and that you can trust. Patients go shopping, go to restaurants, go to the park. Again, just try and avoid the places when they're the busiest. If you go to a movie at 2 o'clock in the afternoon, there's not going to be, the chances are nobody's going to be sitting behind you. But go at 7 o'clock on a Friday evening, and the chances are that that's going to be the case. So common sense. Driving. Shouldn't drive for about 6 weeks after transplant. There's a couple of reasons. The seatbelt can irritate the incision. Plus, not just the pain medicines, any of the medicines, they can just change the way you feel. We don't want you driving if you're dizzy or you've got blurred vision or there's some confusion. So again, I think it's smart enough, just talk to your transplant team and ask them when they feel that it's wise that you actually start to drive again. Next slide. Work and/or school. So most people are able to return to work or school at 3 months. We sort of say that first 3 months is key. If you can stay out of those big crowds, most people, when they're going to work, are going to need to take the subway or the bus to get there. So if that means the 3 months, take the 3 months off, and then you can return to work. Everyone's recovery is different. Some people are going to be chomping on the bit to get back. And again, depending on your labs, check with your transplant team, see what they tell you. If your labs are looking good, then maybe we can let you go back to work. And when we're talking about working from home, then that's really a case of how do you feel? If you feel good and you've got the energy and it's something that you want to do, then move right ahead with it. A lot of people can't work while they're waiting for transplants. Just the demands of feeling the way you do when you're on dialysis, plus the treatments, at awkward times of the day. But we do have guidance as to how we can get you back into the workforce. That's our transplant social workers, and they can give you some information about career services and counseling that you may find useful. I know, I'm not sure if this is around still, Johanna may be able to answer, but VESID was a big thing where you could actually go and you could get training for different career paths and at no cost to you. So I'm not sure if that's still around, but certainly it's, you know, something to think about. Next slide. Psychological health. Yes, transplant certainly can be a stressful time. There's a lot of new things, a lot of new medicines, a lot of new information. You know, it can be stressful for your family. They're feeling it too. You know, the fear of losing the organ, all types of things. But just know that you're not alone. Most people feel these stresses, and you know, it's normal to a degree to feel some depression and or anxiety following a transplant. So again, share it with your team. That's what we're here for. The transplant social doctor or social worker, you know, they can assist you actually seeing a specialist if that's something that's required. We do offer monthly support groups in the daytime and in the evening, and that's for both pre and post patients. So that's something you may want to think about. Caregivers, family members, friends, also welcome to join in. The more the better. So next slide. So travel. Once you're stabilized, that's, again, you get a transplant so that you can go back to live a normal life. As far as international or domestic travel, we would prefer that you give it 3 to 6 months, just for the simple fact we want to make sure that everything's stabilized and you know, optimized before you actually leave us. If you're traveling outside of the United States, then it could be a smart idea to see a medical specialist with international travel. You may need to receive vaccines, and again, this all depends sort of on your destination. Just keep in mind, no live vaccines after transplant. So international travel, only drink the bottled or boiled water, and avoid beverages with ice or using local water. Just drink bottled water if you're for brushing your teeth and rinsing your mouth. Avoid unpasteurized dairy products, street food from the street vendors, and raw or undercooked foods. You can feel pretty safe with fruits or vegetables, however, that you can peel. Your doctor may also prescribe antibiotics that you can take with you, and that's just in case you get the traveler's diarrhea. You may need to use insect repellent containing DEET if there's potential for insect-related disease at your destination. So you guys, if some of these things are required, it's pretty exotic travel, but just better safe than sorry. And next slide. Ask for emergency travel contacts familiar with kidney or pancreas transplants at your destination. Should you have a problem, where should you go? Important to carry a list of emergency contacts. Also check to see if your insurance allows for emergency medical coverage outside of the United States, and consider buying purchase travelers insurance if not. It's actually relatively reasonably priced. Bring copies of your medication list. Bring plenty of extra medicines just in case your trip lasts longer than expected. I did hear at the beginning of COVID that someone was not able to get back, and thank goodness they were able to get the care and the prescriptions, but that's something that can, you know, just keep in mind, you never know. Store your medications in different travel bags. If one of your bags gets lost or stolen, then at least you've got a supply in the other bag. And always keep your medication in carry-on items so that the plane to avoid the risk of lost luggage. And store your medications in the original bottles. You don't want to be stopped at immigration or customs wondering what your pills are. That way they can see. And then have fun. You know, you take these precautions, but then that's just ensuring a safe trip. It doesn't mean that you can't travel widely. Sexual activity and family planning. So most patients do resume sexual activity 2 to 3 weeks following their surgery. If you're female, it's vital that you use adequate contraception. Although you may have not had your menstrual cycle during dialysis, what often happens is you now get your kidney transplant, and guess what? You're fertile again, and you can get pregnant. So contraception, pregnancy needs to be planned. Women can have a child following a transplant, but we do ask to give us 1 to 2 years so that we can actually withdraw one of the medicines, but do it and watch you very, very closely. One of them you cannot take when you're pregnant. So that's something, again, work with your transplant team. Yes, you can get pregnant, but not for 1 to 2 years. So speak with your transplant doctor before coming pregnant. Because that's something that we really should do as a team. Again, you can have a child, but it needs to be done close supervision with the blessing of the transplant doctor and the transplant team. We do need to monitor you closely. Next slide. So erectile dysfunction is a common problem in men with chronic kidney disease. And in many men, this may get better just from receiving the transplant alone. However, in some cases, blood pressure medications or the transplant medications may contribute to the ED. Speak to your transplant doctor, be open, be honest, find out. There's several medications that can help, and why not seek this help? Just remember, protect yourself from sexually transmitted diseases by using condoms. And speak with your doctor if you are sexually active and you've got any questions about your kidney transplant and sexual activity. That's key. Next slide. Health maintenance. Okay, number 1, visit the dermatologist. Skin cancer can be up to 10 times more common in people that are immunocompromised. So vital that you wear sunscreen to any exposed part of your body and see the dermatologist once a year. For women, annual pap smear, nothing that we've not asked from you before. Yearly mammogram if you're over the age of 40 and female. That also, nothing that we've not asked you to do before. Yearly PSA. This is for prostate cancer for men. Colonoscopy every 5 years for anyone over the age of 45, or more frequently, or even earlier if there is a strong family history. Dental care every 6 months minimum. Take care of your teeth and your mouth. If you've got pain, we don't want an infection to develop, and then there'd be a problem. From a renal perspective, you don't require any antibiotics before you go to the dentist, but it's important that you go. And quit smoking. Smoking causes all kinds of health problems, but it also shortens the lifespan of the kidney. And I don't think that that's something that you'd really want to do. This is a great opportunity. It's a new start. It's a new life, whatever. And next slide. Guidelines for taking medicines. So always maintain and carry a list of your current medications. That includes the dose and how frequently you need to take it. Take all your medicines exactly as directed and at the same time every day. Do not stop taking or change the dose of any medicine without the knowledge of your transplant team. Take all your transplant medications with food. However, you do need to be aware that you should avoid drinking or eating grapefruit or pomegranate juice, or any fruits or juices that may contain it, such as Sunny Delight, Fresca, and Squirt. Do not crush or chew your tablets. Do not open the capsules. If you're having difficulty swallowing, talk to your transplant physician, nurse, or pharmacist. There are alternative forms. Do not skip any medication doses. Doing so can put the health and your transplant kidney at risk. Again, The only time that you can take your medicine late is if you're coming to clinic to be able to get your levels checked, but we're going to take it as soon as your blood is drawn. All these things are just, it really is common sense, but it's so important. Tell us immediately if your medicine looks different. So that's probably because the pharmacist has changed it from brand to generic. Well, the doses can be different if that's the case. So that's something you certainly would need to let your team know. We do prefer patients to stay on a consistent form, especially those that work with your immune system, the Prograf, Celseptomyfortic. So if possible, that would be the plan. But if your pharmacy changes, you need to let us know. Do not take any over-the-counter medicines, and I mean any, that is vitamins, herbal supplements, or remedies, without talking to your transplant team first. These medicines can and do alter the amount of drug that's in your system, and so it can create a huge problem. Just talk to us first, and we'll tell you what you can and what you cannot take. Do not take medicine to treat diarrhea, that's Imodium, without talking to your transplant doctor or pharmacist first. And you should never take any of the over-counter pain medicines that fall into the NSAID family. That's the ibuprofen, Advil, Motrin, naproxen, and Aleve. These drugs in and of themselves can damage, and you can actually get complete renal failure from taking these drugs. So it's important that you avoid those. Acetaminophen is good, that's Tylenol, and that's certainly okay to take for pain. If you're prescribed a daily aspirin to protect your heart from your physician, that's fine. But medications do interact with these immunosuppressive medicines, so it's vital you check with your team before taking anything that you've not been prescribed. Next slide. Missed doses. Now, this is a little complicated, but the bottom line is this: you never skip a dose intentionally. You never double up intentionally if you miss the dose. So there is a rule of thumb. If you take the medicine once a day and you forget to take it, let's say you take it at 8 in the morning and at 6 in the evening, you remember, oh, I didn't take it, then you can take it at that point, and you take your regular dose at 8 a.m. the next day. For medications that you take twice, if it's less than 4 hours late, then you can go ahead and take it. If it's more than 4 hours late, skip that dose and take the dose at the time that you would normally. If you're on medication, I don't see that there. Okay, just take the right dose, the right time, and that way you're going to stay out of trouble. Now, if you cannot take your medicines, you either got a stomach flu, you're vomiting, you've got terrible diarrhea, then again, call your transplant team. We need to get that medication into you, and it may necessitate you coming to the hospital, depending how long that's been going on. Next slide. So some of the key points to take from this webinar. To maintain a successful transplant, you have to take the anti-rejection medication, and you'll take this for the rest of your life or as long as the kidney lives, whichever comes first. You'll be on many different medicines after your transplant. Some of these are anti-rejection medicines, others are antibiotics, others are antivirals, but everything is based on an individual case-by-case manner. So your medicines are not going to be the same as the person next door. Stay in communication with your post-transplant team. Get involved and stay connected. Share your story. There's a lot of people waiting for a kidney transplant, and you can really give them hope. One of the things that I always told someone once I called them in for transplant and I would see them on the floor, it's like, you better go back to your dialysis center. Go and show people this happens, this works, because you know how frustrated with the wait and everything you were, and this is just such an uplifting event if you're able to do that. And then the next conversation with kidneys is a detailed session on transplant medicine. We just sort of brushed the surface. So please join us for that. Questions?
I tried to answer all the questions that were in under the questions Q&A. So if you have any extra, there was a question about prednisone that was twice. So I'm not sure if they all can see the answer, but I did answer the questions that were done.
You're on mute, Eliza.
Thank you so much, Yuhona, and thank you, Judith. I'm actually going to read some of the questions with the answers that Yuhona provided, just in case people aren't able to see the chat. And we had mentioned the fluid intake is largely just water, and Yuhona had specified primarily it is water, but non-caffeinated fluids can count towards fluid intake as well. And then the question about prednisone, Yuhona very, very well explained that prednisone may be given along the immunosuppressive medications. Prednisone is a steroid, and it's used to prevent organ rejection following a transplant. And it's used in patients that are at higher risk for rejection. For example, those patients who have sensitivities from maybe a second transplant, or those donor-specific antibodies, which we talked about in our conversation 1. And so not all patients will be on prednisone, but again, as Judith had just emphasized, the team is looking at you on a case-by-case basis, and all of your medications are tailored to you and maintaining your kidney. So your medicine routine will not necessarily be the same as the person sitting next to you in clinic. So really important to remember that. And sorry, we just moved ahead. And then there was a question about exercise, and it's very recommended, but avoid that weightlifting right after transplant. You don't want to, tear any sutures or pull any muscles. And then there's a question about coffee, which is very important, and decaf is preferred, but you can have a little bit of caffeinated coffee. And then there was a question about having a seatbelt, but also if they want to ride on the train with a mask, just utilizing a pillow in between your body and the seatbelt within that first week of post-transplant time. So you're maintaining, protection and a boundary between your transplant. And what about Tylenol? It is okay to take Tylenol. So is the occasional alcohol post-transplant permitted? It is.
Yes, that's okay. We always try to tell patients, to educate patient up front. If you know that you're going to have a glass of wine for dinner, make sure you hydrate a little extra during the day. Every time you have a glass of wine, make sure you have 1 to 2 coverage with water, 1 glass of wine, 2 glasses of water. Same for the beer and champagne. We do not recommend straight alcohol or shots.
Right.
And obviously this is limited. We're talking at 1 glass on certain occasion.
Right. Thank you, Yuhona. Actually, there was a question about discussing the shingles vaccine. Should you have it in way in advance preparation for the transplant?
In general, we do recommend that vaccines are taken before transplant, primarily because you are more immunosuppressed and you might have certain response. If you did not receive that vaccine, then you have to wait at least 6 months, and then after 6 months you will get the shingles vaccine, but at that point will be the not the live shingles vaccine, will be the synthetic one.
Right, because we are not recommending any live vaccines, correct?
Correct, yes. After post-transplant, you qualify for the live vaccines, but now that synthetic shingles vaccine is available, it has the same effect, and actually our patients are happy, are lucky to have it.
Yeah, that's amazing. Please keep submitting the questions. We did get so many. I just want to make sure we didn't miss any.
There's another one. When can I take a train to New York City for doctor's appointment? We do recommend to avoid public transportation primarily because it's a main source of infection. However, after 3 months, we do gradually, our patient continue to live with their regular life. So it is okay to take public transportation, just general precaution, like wearing mask and making sure that using Purell, like to protect themselves. Otherwise, they're fine to take the public transportation.
And there was a question about continuing work after surgery when the person will be working from home.
It depends. I always tell our patient that this is the only opportunity that you can get full 3 months, so enjoy if you do have the time. We do have patients that work from home, and then majority of them, they feel like after 6 weeks, they're ready to go. Some of them do check emails and then work, like even after 3 weeks or 6 weeks, but we highly recommend no earlier than 6 weeks and no later than 3 months.
Fantastic. And then another vaccine question about the COVID vaccine and having it before the transplant, but maybe you can explain what happens.
I can explain more in depth, and actually I want to make sure that you guys understand this, that the importance of taking COVID vaccine prior to transplant, it's like, I can't stress it enough. Right. Once you get immunosuppression, which is CellCept and tacrolimus, then the effective absorption of COVID vaccine, it's going to decrease. And with this decrease, you can get up to 2 full doses, and you can get the booster, and you're not going to reach the antibodies that you would reach prior to, if you get the vaccine, COVID vaccine, prior to transplant. So my advice and my recommendation is take the COVID vaccine before transplant, so you don't have to go through all these steps to even reach the antibodies afterwards. And sometimes patients, even after they take boosters and vaccines, they do not reach the antibodies. So at that point, we do give what is monoclonal form of injection, which is Evusheld, just to make sure that we boost the antibodies of those patients. So do yourself a favor and take it before the transplant.
Right. And Johanna, that should probably fall in line with the requirements now to be listed and active is to be vaccinated.
Correct.
So hopefully we're not having people fall through, but.
I mean, these are the protocols the institutions recommend, but think about your safety and your care as a patient, as individual. If I would be a patient, I would want, especially transplant patient, that I do not have enough immunity, considering that I'm using immunosuppression medication. I would love to have antibodies for COVID, so then this way I'm protected. So I would take the COVID vaccine prior to transplant to make sure that I have those antibodies and I enter this phase of, immunosuppression with COVID antibodies.
Yeah, that's really, thank you for explaining that. That's very well said. We had another question. This is a patient who's 7 years post-transplant and will be traveling outside of the country. And since in the presentation, we recommended not to take Imodium, what is the alternative?
Okay, the reason the Imodium you shouldn't take is because it does affect the motility of your colon. So if you do have a diarrhea for first you go because you're having out of country, really you need to be tested to make sure that there is no C. diff or other before you take the Imodium. But if you want to, just because you're out of country and you feel like it has to do with the food that you're eating there, kaopectate is ideal. So take the kaopectate from here, keep it in your pocket. It's safe to use it. It's not as potent as Imodium for sure, but if you take the kaopectate and it's not helping, clearly you might require to, further evaluation. So that's a sign that you shouldn't be abusing other, medications without being evaluated.
Thank you. That is very helpful. And yeah, it's kaopectate. You can buy it over the counter at CVS. All right, it looks like we answered all of our questions, but please keep them coming. I'm just going to shoot on to the next section, which is just our patient resources. So again, keep typing them in and we'll get to them, but we just want to make sure that, whether you're on this webinar and you're actually post-transplant or you are pre-transplant, that you have access to these resources, transplantliving.org, the National Kidney Foundation, the SRTR, which covers the transplant outcomes. If you are looking for a kidney donor, findakidney.org and the American Transplant Foundation and our website as well. Make sure you stay informed. There is so much information online, and we want to make sure it's from a trusted, safe source. And if you have any questions that you ever need, clarification on, you reach out to our team. We highly recommend Transplant Mentors. This is a free service where anyone who is going through the transplant process can be paired with someone who has a similar story, has been through it, and it can just help prevent the isolation and, help with the nerves that come with this process. As we mentioned, from the psychosocial element, this can be a very intense experience. So we highly recommend getting in touch with a mentor. Judith and I can put you in touch with Patty Draper, or you can contact her directly, but we are really excited about this. And we can't recommend transplant support groups through TRIO enough. This is another way to connect with people in your community that are going through the same thing or have been through this in a different way. And it can be for family members or friends, but it's a really great free resource. And we really want our patients to feel supported beyond just the team. So here are some more resources, and there's many in different counties, and a lot of these meet virtually. So if you have any questions, just send us a message. Also connect with us on our social media. You wouldn't believe how wonderful this transplant community and the hope and inspiration it can bring. Our patients are really something else. And I'm obviously a little biased, but we share events. Likely you found this webinar from our social media site, and we share videos, patient stories, and just it's important for you to stay in the know, so connect with us. We are at WCM Kidney for Instagram, Facebook, YouTube, and Twitter. And then we wanted to invite you to join us for the National Kidney Foundation Walk. This is happening November 13th. It is going to be in New York at Foley Square, and we will be walking across the Brooklyn Bridge. It's going to be a fun day filled with transplant recipients, pre-transplant patients, our team, and we really would love for you to come out and join our team. So if you are interested in something like that, kidneywalk.org/New York/WCM Kidney. You can also join virtually and walk in your own neighborhood if you don't want to come into the city. So then lastly, please join us next month for a similar topic, post-transplant and just the medications. We are going to invite our pharmacists to really help us explain and go through each of these in depth. We knew today there was a lot to cover, and so we wanted to give the medications a separate presentation. And then the following will hopefully be on transplant nutrition. But if you all have any suggestions or topics you do want to hear about, please send us a message. I mean, this is for you, our patients, and we are really, we want to be very intentional with the information and education we're providing. So let us know what you would like to hear and how you feel things are going. So thank you everyone for such wonderful participation. And okay, a couple questions. Is bike riding a good exercise after transplant? I'd say in 6 weeks after they've recovered, 4 weeks. Johanna, you might.
Yes, I agree. Just because the kidney is placed in lower quadrant of your abdomen, and then just the movements of a bike, we do want to protect at least for the first 6 weeks. After 6 weeks, generally our patients are fine to go for bike ride.
Fantastic. Someone asked about the kidney walk. I'm going to put the walk information in the chat box. And again, you will be getting an email from us after this webinar is finished, and it will have my contact information, Judith's information, and our website, which also has all of the recorded webinars and more information. So thank you all so much for joining us today. We are thrilled that we had so much participation. And Yohona, thank you for joining us. And Elisa and Judith, any closing words?
Oh, thanks, everyone. Have a good day. Hope to see you in a month.
Thanks so much, everyone.
Thank you
Enjoy your
all.
day.
Have a great one. Bye-bye.
Bye.
Yeah.